Hi, my name is Dr. Andrea Avian, and I'm going to talk today about my QI project in regards to early recognition of cognitive impairment in internal medicine resident outpatient clinic. I'd also like to thank Dr. Manzo and Dr. Modak for assisting in this project. Let's get started. Cognitive impairment is defined as trouble remembering, developing new learning, concentrating, and making decisions which affect daily living. It is estimated that by 2050, 13.5 million Americans will develop Alzheimer's dementia. Studies have shown that over 40% of the affected population goes unrecognized. As of 2018, the Medicare annual wellness visit required primary care physicians to assess for CI in annual visits for patients over age 65 to improve the detection of cognitive impairment. Several studies have compared the use of MiniCog in relation to other CI assessment tools, and even though it is inferior to other modalities such as the mini mental examination or clock drawing test, this assessment can be a great screening tool. Our aim was to improve screening of CI in a Medicare Advantage population using the MiniCog. We hypothesized that process changes will increase the screening for CI. We screened all eligible patients in one managed Medicare Advantage population over the age of 65 who presented to our resident continuity clinic for follow-up or to establish care. Using the PDSA method for improvement, the MiniCog was used to screen for CI between March through September 2020. In March 2020, the use of MiniCog was implemented and placed on a huddle tool, followed by the addition of an Epic smart phrase for documentation in May 2020, and then lastly, the addition of CI documentation in the rooming section of our Epic system. Patients who screened positive on the MiniCog were referred for more detailed evaluation. The results show that prior to starting this project in March 2020, 36% of the 204 managed Medicare patients had been screened for cognitive impairment. The systematic screening for CI shows improvement in the number of screened patients who were seen from March through September 2020 from 36 to 79%. And you can see that on the graph below. The systematic screening of patients for cognitive impairment can improve rates of screening in a resident clinic by utilizing pre-visit chart checks done by medical assistants, communication via huddle tool. In standardized documentation, we were able to screen a large portion of a Medicare Advantage population. Our rates of screening might have been better, but 34 patients that were attributed to the clinic were never seen. Our next steps are to see if these improvements are sustainable and if we are able to detect early CI by annual screening. In conclusion, with more than 16 million people in the United States living with cognitive impairment, it is crucial for primary care physicians to incorporate CI screening during routine patient visits. As a primary care workforce, internal medicine physicians play an important role in recognizing early signs of cognitive impairment, and by establishing a standardized approach, we were able to improve overall screening rate of high-risk patients. Thank you so much, and please refer to the bottom of the poster for references.